Hi, folks. My name is Angeline, and I am a sexual health educator assistant with Health Promotion and Wellness at SF State. In today's video, we will be going over what happens when someone gets their period, also known as menstruation or time of month, and discussing what PMS and cramps are. I want to take the time to provide you with some terminology. When someone mentions menstrual cycle, it refers to the time between the first day you get your period to the first day of your next period. Menstrual cycles can vary, but typically are between 21 to 35 days. Period length is the first day of bleeding to the last day of any volume of bleeding, usually between 2 to 7 days. Now, what happens during your period? This is a female reproductive system, which typically has two ovaries. The ovaries are where the eggs are stored and mature with the help of hormones estrogen and progesterone. After the last day of bleeding, the uterine lining, also known as the endometrium, starts to thicken with blood, nutrients, and tissue. Around day 14, an egg is released from the fallopian tubes to the uterus. When the egg is not fertilized, hormones signal the uterus to break down the uterine lining, which is the start of your period. While on your period or a bit before, you may notice some changes in your body known as PMS. PMS stands for premenstrual syndrome, where you may feel physical and/or emotional symptoms before or during your period. These symptoms are caused by the hormonal changes happening in your body. Some physical symptoms of PMS include cravings, tender swollen breasts, and cramps. Cramps are due to the uterus contracting to help break down the tissue which causes your period. You may also feel emotional symptoms such as mood swings, not feeling social, feeling sad or depressed, feeling tense or anxious. Here are some tips on relieving symptoms. Taking pain relief medications such as Advil, Aleve, or Tylenol to help reduce cramps. Applying a hot compress for no more than 15 minutes to help relax muscles in the uterus. Engaging in exercise such as yoga poses, breathing exercise, and muscle relaxation can help relieve cramp pains in the lower abdomen. Try out the crocodile pose or child pose for several minutes. While in these poses, breathe slowly and deeply, filling your belly with air. Breathing exercises is another way to help relieve pain. Find a light object to put on your belly. Then lie on your back and place the object on your belly. Slowly breathe in through your nose until your belly and the object rises. Hold for a minute or so and slowly breathe out. Then repeat for several times. Another exercise you can use is muscle relaxation. By sucking in your belly as much as you can, tense your muscles and belly, then completely relax your muscles. Repeat several times. Temporary diet changes can also help in relieving cramps. Lessening foods such as milk, sour cream, mayonnaise, butter, turkey, and chicken can help reduce intensity for cramps, while incorporating foods such as peanuts, peanut butter, spinach, broccoli, pineapples, tomatoes, and whole grains such as oatmeal and brown rice can help ease cramps. Today you learned about period characteristics and what happens during your period, as well what is PMS and cramps, and tips on relieving pain. Remember to follow us on Twitter, Instagram, and YouTube at SF State Cares. To learn more about sexual health and other topics and services we offer, check out wellness.sfsu.edu.